Good morning, everyone. It's Reed in Billings with the Billings Care Transitions Coalition. I'm just going to very briefly introduce this session and ask to take notes and be as involved as time allows, and to encourage all of you to talk to one another after the meeting and with the department. I'm sure it'll share its contact information. And if there is time at the very end for lots of questions, please weigh in. As we go along, it would be for the department to have you enter your chat function. And finally, if you haven't already, please sign in function with your organization and the name, your name. And with that, with the Department of Public Health and Human Services is going to make a presentation briefly about the division that handles the Montana's Medicaid waiver program. So with that, Jill, the floor is yours, the department's for the next hour, okay?
Okay, thank you. My name is Jill Sark. I'm the Bureau Chief of Community Services Bureau, which is the bureau within Senior Long-Term Care Division that we'll be talking about today. Barb Smith is the administrator, was unable to attend today, so I'm pinch hitting for her. When I played baseball in high school, I played shortstop. I wasn't a power hitter, but today I'm pinch hitting. I'm also pinch hitting for Mickey Brown, who is going to speak about home health and hospice towards the end of this presentation. So I'll be 3 people in one day here. We'll see how that works out. So Dave, can you all see the PowerPoint presentation that Derek is showing?
Yes.
Okay. Okay, Derek, you want to move to the next slide? Derek?
Are you able to see that? I just switched.
It didn't switch.
You may need to unshare and then reshare the screen that you want to.
Okay.
Okay, well, the next slide, while he's getting that moved, is talking about the agenda there we go. The agenda that we have today. I'm going to talk a little bit about Senior Long-Term Care Division as a whole. We're going to talk about the Big Sky Waiver program, the Big Sky Waiver residential habilitation services, the Big Sky Waiver Money Follows the Person demonstration grant. And then Abby will talk about community first choice and personal assistance services. And I'll be acting as Mickey, talking about home health and hospice. And then we'll have some time for question and answer. So Derek, any time? Okay. This is an overview in Barb's eyes of the senior long-term care services and supports. She's a lot fancier than I am. I'm kind of a bullet point person, but I'm going to walk around this slide with you. Starting in the left-hand side, the state veterans home bubble. There are 3 state veterans homes that are managed through this division at this time. However, with the reorganization of the department, all state facilities will be moved to a different division, but we still manage state veterans home in Columbia Falls, Glendive, and the newest one in Butte. Adult protective services in the middle covers all of the participants that we provide services to through investigation, coordination, outreach, education, emergency protection, and they handle abuse, neglect, and exploitation of seniors and those with disabilities. On the left-hand side, under the federal grant 15% match, are some services provided through the Aging Services Bureau. They, as it indicates, are funded through a federal grant. Many different types of services for elderly, and in some cases they do provide services to disabled individuals, but they're mostly focused on the aging community. And then under the red box, so that's us, that's Community Services Bureau, and we provide personal assistance services. We'll be explaining Big Sky Waiver program, home health hospice, and recently added to this bureau is nursing facility care. Next slide, Derek. Okay, Community Services Bureau. Again, I think I've said this already. Big Sky Waiver, Community First Choice, which is in-home care, Personal Assistance Services, which is in-home care, slightly less than what is Community First Choice, Home Health and Hospice. Okay, I will provide some information about the Big Sky Waiver, and then I'm going to be passing it on to some other staff here. In Montana, there are 3 1915C waiver programs. One is for disabled, developmentally disabled, another is for severe disabling mental health. And then here in this division and this bureau, we manage the Big Sky Waiver program, which is intended for those that are elderly over age 65 or physically disabled. The reason for waiver programs is to provide services to individuals to allow them to remain in their community and their home rather than in an institution. A person must be financially eligible for Medicaid and meet a level of care for a nursing home placement. That level of care is determined by Mountain Pacific Quality Health. I see there's some staff here on the call today. Individuals must also have an unmet need that can only be met through the Big Sky Waiver program. And currently, as always, there is a wait list for the program, and today's wait list is 245. Next slide, Derek. Further eligibility is each person must work together with a case management team, or if they're participating in the self-direct option, an independent advisor, to develop a service plan that will meet their identified needs. And the service plan would include services that are available through the Big Sky Waiver program. Big Sky Waiver is not an entitlement program as like state plan, regular Medicaid, which means even if you're eligible, it doesn't mean you receive services, which means there can be and usually is a wait list. So if a service or supply can be provided through state plan or regular Medicaid, that's a prior resource to Big Sky Waiver. And referrals for the Big Sky Waiver are managed through Mountain Pacific Quality Health. Next slide. This is a list of some of the, well, it pretty much is, I think we have all of the services listed here through Big Sky Waiver program. The services with the asterisks are services that are provided through the self-direct option called Big Sky Bonanza. Next slide. I'm going to step aside now. Derek's going to have to do 2 things at once. He'll give his presentation as well as move his own slides.
Sounds good. Good morning. I'm Derek, and I'm the Adult Residential Program Manager with the Big Sky Waiver. And then also just to put a plug in, with Adult Residential Services, we did, as Joe mentioned earlier, we slid nursing home Medicaid services into this nice little category here for residential settings. Under Big Sky Waiver, adult residential facilities will be provided through the Big Sky Waiver program. Unlike nursing home, that's entitlement. Big Sky Waiver is not. So to access assisted living, adult foster care, and community homes for persons with physical disabilities or group homes, they would have to be enrolled participant with the Big Sky Waiver program and meet eligibility requirements. Also with adult residential settings that we provide within the Big Sky Waiver and the Community Services Bureau, over the past couple of years, we have engaged an assisted living work group with various providers from around the state, different communities that we're working to obviously wanting to improve access to Big Sky Waiver adult residential services, provide the department with eligibility issues, such as Medicaid eligibility, which is pretty much the golden ticket into this service, evaluating adult residential service delivery and systems, and then assuring consistency, reliability, and transparency. A part of this work group as well is to identify, a smooth transition from private pay to Medicaid, so they can age in place in the assisted living facility of choice, or perhaps graduating from a skilled nursing facility or a discharge from a hospital setting. We work together to try and develop processes to make that transition smooth and reliable and ensure good outcomes so they can, like I said before, age in place. This is a page that just resources for you to look at your leisure. This is a lot of partnerships that we have with the adult residential program that we have through Big Sky Waiver, partnerships with aging services, ADRC, adult disability resource centers, the ombudsman program. And then of course, I did put a link on here for individuals who may need to newly apply for Medicaid. As mentioned earlier, and I'm going to go back, one thing about the services that we provide is they are licensed through the state of Montana. So that is one key component. So, and I'll just leave it there, and I'm going to just pass it off to Michelle, but we can always come back for questions and answers.
Thanks, Derek. So my name is Michelle Christensen, and I'm the project director for our Montana's Money Follows the Person demonstration project. I've worked with transition groups, going back probably 8 or so years. And I have to say, I love the work that you guys do. And I miss being very, very involved with you. And it's a lot of names that I recognize. So thanks for giving us this opportunity to talk to you. Money Follows the Person demonstration grant is designed to help folks who are on Medicaid leave an institutional setting and return to the community. We know that about 65% of the people who are in a nursing home report wanting to return to the community. So we want to support that. In order to be eligible for Money Follows the Person, the applicant has to have Medicaid. They need to have been in a nursing facility or so nursing home, out of state, LTAC, one of those for 60 or more consecutive days. One of those days has to have been covered by Medicaid. They need to be elderly or disabled, and they need to participate in one of our waiver partner programs. So I'll just step aside here and tell you that when I talk about waiver partner programs, it's not just Big Sky Waiver, although that's a big key part of it. We also assist folks who are on the SDMI, mentally ill waiver, and the developmentally disabled waiver. Next slide. So what makes MFP different? Why would we access MFP? Well, we know that there are services that are entitlement services that will cover someone when they're in a nursing home. But they won't necessarily provide the services an individual needs to return to the community. Those are generally non-entitlement services. And as such, as Jill indicated, there's a wait list. So MFP bypasses that wait list, and it allows us to provide people with some services that aren't even available through waiver. For example, we can provide a transition coordinator. So that's someone who's going to work with an individual to develop a transition plan, to identify risk, and do a mitigation plan. We can provide utility and rental deposits. We can help with resolution of credit issues. So if we've got credit issues that are stopping someone from returning to the community, they can't get housing because they've got bills that are in arrears, we can help with that. We can provide household setup. So often when someone's in a nursing facility or an institutional setting, they lose their furniture. Maybe things were in storage and they didn't pay for the bill or whatever. And so they've lost their furniture. They've lost all of their household goods. So we can help set that up. It's limited furnishings, so we're not going to go crazy with it, but we can buy a mattress and a kitchen table and chairs and stuff like that. And then some household goods just to help folks get set up. Silverware, dishes, paper towels, things that we all need when we're setting up a household. We cover the first 365 days of waiver participation. And then after that time, the waivers then pick that person up and they're covered under regular waiver. They're no longer participating in a demonstration service. We also can provide, the last two things, assistance with obtaining medical equipment and environmental modifications. And what's different about the demonstration service than a typical waiver program is that sometimes in order for an individual to discharge to the community, they have to have that wheelchair ramp in place, otherwise they can't get to their home. Well, under traditional waiver or a traditional state plan, those services can't be made available until the individual is discharged. Under MFP, we can look at ways to provide that service to get them back to the community. Next slide. Referrals. So you can make a referral online at this website, this link here that's here, or you can certainly call me. And I would say anytime you have a question about Money Follows the Person, whether or not an individual might be appropriate for that program, or just kind of an inquiry, please always feel free to call me, or you can email me. I put my email address in the chat. Very happy to talk with you. The goal is really to get people back to the community. It's where they want to be. It's where we want them to be. Thanks, Derek. Thanks, you guys.
Okay, so I'm back as Vicki Brown, who is the section supervisor for the Big Sky Waiver section in Community Services Bureau. And she also doubles as the program manager for the hospice and home health programs. So the hospice program managed here is available for people that are eligible for Medicaid. And I think most people know hospice is for comfort care at the end of life, palliative care only. Children ages 18 and younger may receive curative treatment. Next, hospice eligibility, as I mentioned, a person must be eligible for Medicaid. A doctor must sign and certify that the individual is terminally ill and has 6 months or less to live. The individual signs a statement that indicates that they will not be receiving any curative care. And treatment is delivered by a Medicare-approved hospice program. We have hospice programs across the state that provide care to both Medicare and Medicare Medicaid combo. Next question, or next question. Next slide, Derek. Okay. Home health. Home health services are when someone is leaving an institution and needs some care in the home. Typically it's nursing care, but it can be other types of care. The care is signed off by a physician that is necessary to be received in the home. Next slide. Person receiving home health services must be referred to the home health agency. So it begins with the doctor's office and obtain a prior authorization through Mountain Pacific Quality Health. So there's quite a few people from Mountain Pacific Quality Health on the line. We have quite a relationship with them with most of our programs. Members receiving home health services must be eligible for Medicaid as well. Next slide. Okay, I'm going to send it off now to Abby Holm, and Abby will talk about Community First Choice and personal assistance services. Abby, are you there?
I am. Hello. Can you hear me? Yep.
Yeah.
I see a head nod. Okay, thanks. Well, good morning, everyone. My name is Abby Holm, and I'm the Community First Choice Personal Assistance Services Section Supervisor. When we talk about Community First Choice and personal assistance, those are two Medicaid programs, and we speak about them pretty interchangeably because they're both deliver very similar services. So I'll tell you the difference as we move forward, but really when we say Community First Choice or when we say personal assistance services, we're talking about the same programs. And those are both Medicaid entitlement programs that provide long-term care to folks in their homes. I just want to stop for a minute. I know we've talked a little bit about waiver and we've said the word entitlement. We've talked about home health and hospice. So Medicaid entitlement programs are state plan benefits that anyone who meets the medical functional criteria for that service is eligible to receive it, so long as there's an enrolled provider that can deliver the service. So Community First Choice and personal assistance are similar in nature to physician service, hospital services under the Medicaid benefit, in that if someone needs the service and there's a provider to deliver the service, they can receive the service. There's no budget limits, caps, or wait lists as you would see under waiver. So in that vein, it's similar to home health and hospice. I think where it differs a little from home health and hospice, for example, is both home health and hospice are funded through Medicare as well. And Medicaid is really the primary funder for the benefits of community first choice and personal assistance. It's not typically covered by third-party insurance. There are some exceptions to that through VA services and but primarily not through Medicare or third-party insurance. So we have a robust program in the state of Montana that serves over 3,000 members every year. It is a program that's available across populations. So we don't just serve the elderly and physically disabled, we also serve folks with developmental disabilities, mental health issues. So this crosses all populations. Anyone who needs the service is eligible. And we work and have members share services across the different waivers. So today you've heard about the Big Sky Waiver. The CFC Pass program also interfaces with developmental disability waiver, with the serious disabling mental illness waiver as well. I do want to mention, and you're probably aware of this as well, we do have some service access issues that are unique to workforce. So if someone's qualified for services, they're eligible to receive it, but sometimes we're finding that our enrolled provider agencies are unable to deliver the service due to workforce issues. We have some challenges recruiting direct care workforce or workers. So as you're working with discharge planning and other issues, that can come up, and it needs to be identified and assessed, because just because someone qualifies doesn't mean they'll be able to receive the service if there are no workers. Mountain Pacific Quality Health does handle all of our referrals. As of January 1st, they are back in the kind of the authorization referral seat. For a while during COVID, they were not. So if you heard of needing to go directly to the provider agencies, that was something specific to the public health emergency. But as of January this year, they are handling all the referrals for the Community First Choice program. And they do look at the member in their home environment and assess unique kind of individually based on those needs. And the slide here that we have, go ahead. Perfect. You're reading my mind, Eric. Talks a little bit about those specific services that Mountain Pacific is going to be looking at and authorizing for. The core service package for CFC Pass is those activities of daily living, or ADLs, related to kind of our daily care routines: bathing, dressing, grooming, eating, medication reminders and assistance, exercise. We also provide medical escort, which allows assistance to get someone to medical appointments if they need some sort of prompting, cueing, or hands-on assistance to get to those appointments. I always describe these kind of as just the basic routines that get you up, get you going in the morning, and it'll get you to bed. What this program doesn't provide is supervision. So the program won't authorize time to supervise someone throughout the day in completing their care routines. And that's a big distinction. What this program provides is assistance with hands-on assistance for those activities of daily living, or if they need prompting or cueing around those activities of daily living. Also want to mention, we said this before, the program provides these services to someone in their home. It's not a program that provides services in an institutional setting, such as hospitals, assisted livings, nursing homes, or other group home settings. Now, if a member needs assistance with activities of daily living, then they're also eligible to receive some limited assistance with those instrumental activities of daily living, such as grocery shopping, housekeeping, and laundry. And those services are authorized in conjunction with the delivery of the activities of daily living that a worker would be performing. So a worker's going in and getting someone and helping them get dressed, brush their teeth, get a meal. They're also then going to be providing cleaning of the house and laundry related to those services. For folks on the Community First Choice program, and this is where it differs from the personal assistance program, there is the availability to provide some additional services. One is community integration, which is defined as, assisting the member in getting out into the community to support them in engaging in activities for community inclusion. Also available is yard hazard removal, which is not lawn care, but it's allowing safe entry for a member to get to and from their home. So for example, in the middle of winter, that might include shoveling snow from the doorway to the garage, or the front door to the sidewalk. In the summer, it could be removing yard debris and things like that. And then in addition, the program provides correspondence assistance for folks who are able to direct things such as opening the mail, filing paperwork, but can't do it due to limitations with their hands. They can have a worker do that upon their direction. It isn't a payee service. However, it's not for people who aren't able to direct these types of activities. So that is just one point of clarification. And then last, if someone again has a need for an activity of daily living, then they're also eligible for a personal emergency response system, such as a call button or an activation, so that if they fall and they live alone, they have the ability to reach out and get emergency assistance. Next slide, Derek. Eligibility requirements for both of the programs is, as I've mentioned, they need to have a health condition, a functional limit on their ability to perform activities of daily living, such that they need someone to support them with, as I mentioned, hands-on assistance, cueing, or prompting. The member needs to go through the screening process, and that is a process with a Mountain Pacific quality nurse who will meet with the member and assess them for a whole array of needs and look at their function, their limitations, kind of their functional need for that service. And then they'll authorize time based on the need unique to each member across a whole array of activities of daily living. And of course, this is a Medicaid funded program, so all of the members need to be eligible for Medicaid. In order to qualify for the Community First Choice program and to then have access to those services I described on the prior slide, which included the yard hazard removal, community integration, correspondence assistance, and the personal emergency response system, the member also must meet a level of care criteria for nursing home placement. So in that way, it's similar to the waiver eligibility criteria for level of care. If a person doesn't meet that criteria, they're still eligible under the personal assistance program for the basic activities of daily living and the limited instrumental activities of daily living that were on the other slide. So if you have folks that are in need of this service, Mountain Pacific does take the referrals. Anyone can make a referral. They have a 1-800 number. So anyone can call, you can submit it via fax. There's a form, and all of the provider agencies across the state have access to that form, and so they can do the referral process as well. And with that, I think I'll hand it off. And I know I've seen some questions. I think we're going to take those in a minute. And I do see that Jennifer Zodi with Mountain Pacific provided the referral for Mountain Pacific. It's 1-800-219-7035. We've also provided links to our website. So there's a link to the website for senior long-term care, which will have all the information on all the programs we've gone through, and there's a information on Community First Choice and the referral process in there as well. I did want to say one other thing. When Mountain Pacific gets the referral, they will provide the member with a list of all the provider agencies that serve their county. They can select that agency, and then Mountain Pacific sends the authorization information to the agency so they can begin serving the member.
Okay, thanks, Abby. Derek is on the last slide, which does not include our direct phone lines, and that's been asked in the chat. I will be adding the JAR direct phone numbers on this slide, and I'll send it back to Alana before she will send it out to everyone. The website links are on the very first slide. I would suggest the last one, that is CSB/providers, and that gets you right directly into Community Services Bureau programs, and then there's a link for each program there. So that's a really good link to have. Now, my understanding is Alana will be reading questions from the chat to us, and whoever the question belongs to, Abby, Michelle, Derek, or me, will jump in and answer them.
Perfect. Yep. So we had one from Jay Scooter asking, please explain the difference between your hospice and HHC services versus other agency provided services, how to distinguish which programs to refer to.
Okay, so hospice would be for someone who is needing end-of-life care only. Hospice is a program that a person accepts and will no longer accept curative care, and a doctor must verify that the person has just a short time to live. Home health care is the program where maybe somebody had a surgery and they're coming out of the hospital, and it's just temporary care. A doctor will release someone discharge them from the hospital with this care only for a certain period of time. The other programs are programs for people to remain in their homes. They're not temporary programs. They're services and supplies. And as Michelle mentioned, maybe home modifications, things needed so that somebody may live in their home rather than live in an institution.
And there's a follow-up to question to that as well on the very bottom from. If you want to read that off. Or do you want me to? I have no problem.
Alana was going to read the questions, and then if it's your question to answer, you answer it.
So Scooter just wanted to clarify that. He said, sorry, was not clear, meaning how to know we refer to this program versus an independent community-based agency. What is the distinction?
An independent, I guess I don't understand the question then. If it's somebody, the programs that we manage here at Community Services Bureau are programs for people who are receiving Medicaid and need care to remain in their home rather than go to an institution, or need care to come out of the hospital for a temporary period of time, or need care at end of life. And so I'm unsure what he means by an independent.
And if Jay Scooter, if you want to, you can also unmute yourself. For those of you who are unfamiliar with mute or with Zoom, down in your left-hand corner, there should be a little mute button with the little speaker icon. You can click that, or else you can press the space bar.
Hi, yeah, this is Scooter. Yeah, kind of like Rihanna added in. So, for example, there are private agencies such as St. John's, Riverstone, Capasas that have hospice and home care services. So how do we know when a patient would benefit better from your hospice and home care services versus a private agency like St. John's, Riverstone, Capasas, and things? What's the difference? What's the key to refer them to you guys instead of a private agency?
So you wouldn't refer to Community Services Bureau. The reference goes to a hospice program from the physician. And the difference is Medicaid eligibility.
So am I understanding that this is just for any hospice services or home care services that would be provided by a private agency? It's not something specific under the Big Sky Waiver program or something?
This is not under the Big Sky Waiver program.
Okay, gotcha.
The hospice or the home health agency must be a Medicaid provider, a
Right,
Medicare Medicaid.
right. Okay, I was thinking that this was an additional program, so that's where I was confused. Thank you for clarifying.
Great.
Right, and then we had another question from Michael. Can you give us an idea what eligibility criteria is for Medicaid focused on single or married elderly individuals?
So the Medicaid eligibility determination happens at Human and Community Services Division, which is their bureau is the Office of Public Assistance Bureau. Eligibility for Medicaid is very complex, but they must be eligible for standard Medicaid. Married individuals, just like entering a nursing facility, if a couple together have income that exceeds the eligibility for Medicaid, they can have a resource assessment determination. And then when they become eligible for a slot for Big Sky Waiver, they are assessed as a single individual. Children, same thing. If their parents cause them to be ineligible because of income and resources, once a child is offered a slot and is enrolled in Big Sky Waiver, their parents' income and resources are waived so that that child can be determined eligible on their own. There are many different Medicaid eligibility programs. Our waiver eligibility includes all Medicaid eligibility programs, as long as it is standard eligibility, which the difference between standard and not standard would be the Medicare beneficiary programs known as QMB and SLMB, QMB and SLMB. And those are Medicaid programs that just cover costs of the Medicare premium or the amount that Medicare, the 20% that Medicare does not cover. So eligibility for Medicaid, standard Medicaid is the criteria. We don't make that determination here at Community Services Bureau.
All right. And so then we have another question from Katrina. Abby Holm, you said CFC needs to go through Mountain Pacific Quality Health for nurse evaluation first. I know this was waived during COVID surge and we were to refer directly to an agency. Is this still the case, or are we back to contacting Mountain Pacific first?
Yes, as of January 1st, 2022, all referrals for community first choice personal assistance services through Medicaid will need to go through Mount Pacific Quality Health. There is the ability for an agency to do high risk intakes if a member meets the criteria for needing immediate services, and that's always been available. But if you're serving a member, you should, or looking at services for somebody, you should send the referral to that 1-800 number, 1-800-219-7035.
Great. And then Karen had asked, is there a nursing home benefit if all other options have been exhausted? Derek,
You're
I
on
think.
mute, Derek.
I thought I pushed the button, I'm sorry. So, so anyways, there is a long-term care benefit for nursing home. Unlike Big Sky Waiver, it is an entitlement benefit. So if they meet eligibility requirements determined by OPA, they should be able to access nursing home Medicaid or long-term care Medicaid. So there is that option.
Great. And then there was another question from Karen. Where do you refer a person for resource assessment?
And then similar, that would be a process facilitated by the Office of Public Assistance. So if there is a spousal component to that application, that will be facilitated strictly through OPA. That does not occur at central office here at CSB.
I appreciate that. This is Karen. Specifically, do you know how we contact that office then?
So on my resource slide, after adult residential, I do have a link to OPA at apply.mt.gov. And that is the portal. And then also there is phone numbers available in that link as well to the cloud, which will get you to the eligibility specialists upon application.
Okay, thank you very much. Thank you.
Great. And then we had one other one from T Harm. Once selected from the wait list for AR service, we find it often takes OPA 4 weeks or more to return the MA 55. Facilities do not accept entry until the form is signed off by a OPA. Applicants are failing in the community while waiting for a form. Can this process be sped up or improved in some way?
I'll
So-
jump in. Derek, you want to just mention the new process we have with case management teams?
So what we have done to address that, because that is an overarching concern amongst all assisted living facilities and residential settings. So what we have developed is a process with the case management team that we can basically, what we want to do is to make that transition from private pay to Medicaid seamless. So what we've developed is a process with the case management team where we've identified that AR person, that adult residential member, and we can go ahead and start the process to get the service plan signed, get the MA 55 requested, and then we can go back to the date of this, to the signature on the service plan. So yes, it is a concern that there is a risk that the MA 55 can be denied. We don't always know that immediately, but we are working actively to try and speed up and make that a seamless process. So there are steps that we're doing with the case management team, but it also goes back to the responsibility of the member or their representative assisting them with the application to make sure that the needs are being met as requested by OPA. So it's kind of it's definitely a dance. There's a lot of people involved, but we are working to address that issue, and it has shown success. It has shown success. And then I'm also, if necessary, we can share that. It's something that we did develop in the assisted living work group, as that was something that is brought up frequently with those providers a part of that. Does that answer the question, or if you want to definitely go off mute, just so I didn't miss the mark, making sure I can get that question answered.
Derek, I think I'll jump in. I think one piece that I did hear on the question was, what you explained is exactly right. We've made that change so that somebody already in the assisted living facility can have an easy transition. And the MA 55 can be retrospective to the date. But I think that person was talking about in the community. And so if somebody in the community is moving into an assisted living, wants to move into an assisted living facility, I would say, when I look at the Department of Public Health and Human Services, I look at each division as they are our cousins. And so they are our cousins over at Human and Community Services Division. So if there's a holdup of eligibility determination, we would refer the person that is wanting the slot to them. We wouldn't have a way to speed that up. It would have to come through Human and Community Services Division.
And that's true. And that's where, when you are contacted by a potential resident to move into your community, I think the first most important conversation is have you started the Medicaid application process? If they have, what feedback have you received from the Office of Public Assistance? And then have you followed up on those requests? And if there's a resource assessment, that's an added layer. So definitely that conversation needs to occur. One thing that I think it's important to make clear is we may be Medicaid waiver, but we don't determine eligibility. We're dependent on the Office of Public Assistance to make that determination. It is a misconception that because we're Medicaid waiver, we should know eligibility. We have that information at our fingertips, and we don't. So it's, we do try to work with facilities and different communities to speed up the process, and we can be an advocate in that way. But it's definitely a conversation that needs to occur with the applicant and their supports. The other thing that if there is an indication that this person in the community is at risk, because typically we don't need to go to assisted living until it's a crisis situation, commonly. So it's a matter of, if it's identified to be an at risk, let OPA know that this person is at risk and this application should take priority, no guarantees, but you can indicate to them that this person is at risk. So that's another layer, but just as a clarification that Big Sky Waiver does not determine Medicaid eligibility. We get the determination and then we move forward with enrollment into the waiver.
Great. And Sue had, I'm not sure, Sue, if this was more of a question or a comment, but Sue had mentioned you need to apply for Medicaid, even if you don't know it will, I assume, be denied for resources to get a resource assessment done.
You know, and not being competent in Medicaid eligibility in all things Medicaid, you know, that question I would definitely direct to the Office of Public Assistance. Anything Medicaid eligibility application, I don't want to provide wrong or incorrect or not good information. So I would encourage anyone to go right to OPA and ask those direct questions. Just as a courtesy, because I don't want to send you down the wrong path. And again, that all the information to get to OPA is on that link at apply.mt.gov. And there's some other links in that area as well when it comes to Medicaid benefits.
And then Rihanna asked, I have many patients stating it is hard to get through the OPA office. Is there an alternative phone number or way for our patients to access the OPA office?
You know, again, on those links, they want you to go through the cloud. Just saying. But then also, you can also do a portal and do your member portal establishment in there as well. But again, go to OPA. And the cloud is what they refer to at OPA. It's just the data dump of all the contacts and everything Medicaid eligibility.
And then
There's a question about what you just said about going through the cloud. Would you clarify that? I know that you know what it means, but apparently some people out here would like you to clarify that.
So so, you know, just to, you know, to keep it simple, the cloud is kind of where all the information and data goes to the Office of Public Assistance, the phone calls, the documents that can be scanned, and then it's dispersed out. It's really, in all honesty, it's OPA in its grandiose form. Jill, maybe you can type in and see and make it sound better.
Sure, I'll jump in. So I worked in OPA for 24 years, and back in the day when if you lived in Libby, you came to the Libby office and that's where your assistance was determined. I also worked in the Missoula office and the Kalispell office and at central office here for food stamps. So there was a change where rather than the only place that you could apply was Libby, if you lived in Libby, you can apply online. There are still offices in some towns that you can actually go down to the office, but I believe that they ask you to, you can complete the application. It doesn't mean it's going to be, as my understanding is, if you turn in an application, it won't necessarily be managed by an eligibility worker in Bozeman, even though you live in Bozeman. So they work on the applications. I understand also depending on what kind of an application is, they have teams that work on applications. But you can go, when you go to the cloud, you can fill out an application online and you can submit it online. You can also have access to your case file online. You can receive your notices online. I haven't worked there for a long time, so I don't answer too many questions because I don't want to give an incorrect question, but there is an 800 number. They have some options through that 800 number. of how to get to someone, to ask a question. And that's our only answer to you is that's the method to take to contact OPA.
Great. And then T Harm asked, at one point during the pandemic, the requirement for a disability determination was waived. Then it was re-implemented. Now it seems it's been lifted again. How might we know if a disability determination is required or not?
I'm assuming the question is for the Big Sky Waiver program. And if that is the case, it has not been waived through the pandemic. To be eligible for the Big Sky Waiver program, a person must be physically disabled or elderly over age 65.
And she confirmed, yes, that's what she meant. Do you know if the OPA office are back to being open fully?
I don't know the answer to that. I believe they are, but I don't know the answer to that for sure in every office. I don't know.
All right, we're pretty much caught up on questions and chat. If anybody wants to come off mute, you're more than welcome to.
Bill, this is Dave Wanzenreed, and all of what you folks have talked about, and thank you for organizing the information in such a presentable way. What do you feel are the most important takeaways from all of what you've presented today? What do you feel are commonly the most misunderstood parts of the Medicaid waiver program that you would like to emphasize for the benefit of those people that are on the call today?
I think I'll go first and then I'll have Michelle and Derek as well chime in. I'm going to talk about the wait list. I think one of the most misunderstood parts of the Big Sky Waiver program is the wait list. Most people think that, well, if I apply on January 12th, when the next slot comes open, as I am in the line, so we have 245 people. So after 245 people are served and receive a slot, then I will receive a slot. And that isn't how people come off of the wait list. Everyone that goes on to the wait list is provided with a score depending on their need. Someone with a very high need would have the highest score, and someone with not as high of a need would have a lower score. So I could come on the wait list today, have the highest score of people on the wait list, and a slot comes open and I would get a slot before that person. So I think that's one of the misunderstandings of the Big Sky Waiver program. And then the other one is when we talk about payer of last resort, when we talk about entitlement, Big Sky Waiver is not an entitlement program, which means if you're eligible, you receive the services and supplies of that program. Big Sky Waiver is provided a budget. There's through the legislative sessions, and we have to stay within that budget. We also receive a number of slots that can be served through the program from the legislators. So we have a fence around how much can be spent. Whereas on entitlement programs, if you're eligible, you can receive the service. So I'll see if, Michelle, do you have anything?
Yeah, I think the only thing I would add from the money follows the person perspective is to remember that money follows the person applicants bypass the wait list. So they aren't subject to the same criteria. We think that if they're in an institutional setting and they qualify for MFP, we're prioritizing those folks. So questions on that, you can feel free to email me or call me, and my information's in the chat. Thanks.
Great point, Michelle. Derek, what do you have?
You know, you and Michelle covered that well. I don't really have anything to add. But if there is direct questions in regarding assisted living services, eligibility, access, you're always welcome to reach out to the department or myself to ask those questions. We're happy to look at it on a case-by-case basis. I think that's one thing as well, is that it's not a one-size-fits-all approach. And we do look things individually and on a case-by-case basis. So, that's one thing about Big Sky Waiver is we get to break off from the federal rule, which is part of that 1915C model, and we can look at it on a case-by-case basis. I think that's the biggest takeaway as well.
Steve, did you want Abby to talk about community first choice?
Whatever you feel is appropriate in terms of information, Jill, that would be just fine.
There was an additional question that came in from Katrina on the Big Sky Waiver. Is this able to provide licensed nursing medication management services such as for titrating insulin?
Yes, Big Sky Waiver does have private duty nursing in the home as one of the services available, but not available for children. Children can receive private duty nursing in the home through standard Medicaid.
And then I'll also add for Katrina is Big Sky Waiver is a payer of last resort. So if their Medicare benefit or an insurance benefit would be a prior payer, that would be assessed before Big Sky Waiver would take on that private duty nursing role. It just depends. Again, it's on a case by case.
And there was one final question there from Sue. How do you get your score reassessed if your condition was to decline?
So if you're already on the Big Sky Waiver waiting list, oh, go ahead, Jill. I was just going for the gusto.
You're there, go for the gusto, you know it.
So if you've already been referred to the Big Sky Waiver program and you're on the waiting list and your condition does change, decline, you can reach out to the case management team and request that the applicant be rescored at any time. And if it does require a modified screening with Mountain Pacific, we'll have that conversation, but typically the first contact would be with the assigned case management team in that area.
And the case management teams do follow up is it 90 days?
90 days.
90 days, yeah.
Are there any other questions?
And we will get the updated slides with the phone numbers that Jill will provide, and we will get these out to all of you who are attending today. And this was also recorded, so we can send that recording out when it's available as well.
If there aren't any other questions, I'm going to, it's getting to 8 o'clock and I promised all of you we would adjourn promptly at 8. Thank all of you for joining us. Thank you all and Helena for your presentations about something that's critically important to Montanans. And for those of you that are on the line, if you want more information, reach out to me, let me know, and I will send those requests to the appropriate person at the department. And finally, we're recording this, and for those of you that had to leave or someone had to leave early, just let them know that we'll be sending that recording out within the next week. And with that, I'm going to thank all of you for joining this morning, and thank you for what you do every day to take care of those and provide treatment for so many people that are in need in our state. Best wishes to all of you. Happy New Year. And again, Jill, thank you and the rest for your patience this morning.
Sure, thank you. We love to be able to provide. And Dave, I just say go Bobcats.
Go Grizz. Hey, everyone.
Thank you.
That's all the way. Thank you.
Thank you.